Now to Nigeria. As the number of coronavirus cases continue to rise in the country, the health sector is confronted with the lack of enough hospital beds to accommodate COVID-19 patients. Scientists are busy on clinical trials to help mitigate the pressure on the health centers as hundreds of thousands cases are projected by July. Let's have more details of that in this report.
It's a situation many had feared could happen as the COVID-19 infection rate keeps going up in Nigeria. Now, the head of the country's Center for Disease Control says states are fast running out of bed spaces at their various treatment facilities. The NCDC puts the total number of bed spaces across the country at about 3,000, with Lagos, the epicenter of COVID-19 in Nigeria, accounting for the bulk of that number. But the challenge is that the pace of the infection rate in the city is now mounting serious pressure on the healthcare infrastructure available.
So our model suggests that by July, we're going to see somewhere between 90 to 120,000 positive cases. However, our testing algorithm only tests for people who have developed symptoms.
Desperate to address the situation and increase the discharge rate of patients in the city, health authorities now say they would begin a clinical trial of hydroxychloroquine.
We've just received the shipment of the first batch of chloroquine, hydroxychloroquine, with its placebo counterpart. It is the most powerful clinical trial that you can do, and we have developed several arms of these clinical trials. We're going to be looking at other drugs that are currently trending in the research arena.
The Lagos state government has also said it would soon begin what it calls community management of COVID-19, with primary healthcare centers co-opted into the treatment of patients.
Over the past 6 to 8 weeks, we have been building the capacity of our medical staff to handle and treat patients with COVID. Not only the people in the isolation centers, but people in all our health facilities. And each one of them now has what they call a COVID response team.
The government recently eased the lockdown on the city and made the wearing of face masks in public mandatory. It also asked people to practice physical distancing. But compliance has been a major issue. The government now says it would begin cracking down hard on defaulters.